The first in the world to record more than 400,000 coronavirus infections. That's in just one day.
Whole world is still struggling to find effective drugs against the virus since coronavirus is emerged, and vaccination for all is still a mirage. We are working on alternative system of medicine and ethnobotany. Ethnobotany is the branch of science that has given many new drugs to the world. The ethnobotanical practice I am going to talk has no time for ifs and buts, like what are the research data, what are the results. Concrete research needs time, and time we don't have. Today the biggest problem of corona is its spread and infectivity. The ethnobotanical practice I am proposing is just a prophylactic measure, means the prevention of spread. It is a self-care and a hope because corona is spreading with super speed, especially in India. It is just a possible way to help stop spread of corona from person to person or even lower the severity. It may appear funny to many, but sometimes a small idea may work. So let me tell you about a plant that has been traditionally used to cure influenza. This is the plant scientifically called Calotropis procera and Calotropis gigantica. Mainly there are two species most widely available. In Hindi it is called aak and erg in the Ayurveda. Traditionally, this plant is used to cure eye influenza, also called as eye flu or the pink eye. हिंदी में इसे आँख आना कहते हैं. In this, one gets his eyes red, watery discharge, itching and pain in the eyes. It may be in one eye or both the eyes. It is so contagious that if someone touches his infected eye and touches another person, then other person also gets infected. That means infection is transmitted. As we see here, pink eye infection is shown by many different types of viruses. Now, how people treat it traditionally. When a person gets eye influenza infection, he goes near to this plant and leaf or twig of this plant is plucked from the stem. It releases a white milky secretion which is a latex. Its white milky secretion is applied on the sides of nail of the toe. But there is a protocol. If right side of eye is infected, then skin around the nail of right toe is filled with this milky juice oozing out from the petiole of the leaf. It is applied once in a day and for 5 days. The effect is visible from the second day and eye influenza is cured by 5th day. It sounds amazing. You may ask, such a contagious virus and is cured by just applying on sides of toenails? I understand. Modern science at this stage of knowledge won't believe it, but it happens with eye influenza. Traditionally, it has been used by tribal and the native people. I have been using it myself many times since my PhD days, whenever I got eye flu. The ethnobotany literature also confirms the same. You may now ask, how does it work in influenza? This is the picture of toenail. The sides of nails is called perionychium in medical terms. The nail is often considered an impermeable barrier, but this is not true. In fact, it is much more permeable than the skin. This permeability has implications for penetration by chemicals and medicinal substances. When we apply latex of the plant on perionychium, it gets absorbed through blood vessels underneath the nail bed. It may be called and compared as subcutaneous vaccination. However, in true sense, it is not vaccination, as in vaccination we exploit a specific antigens of virus or bacteria to induce immune response against that particular antigen. There are dozens of pharmacological compounds present in this plant like alkaloids, polyphenols, flavonoids, terpenes, lignans, glycosides and others. Those are absorbed through the skin around the toenail. These molecules then reach blood circulation via the blood capillaries of nail bed and carried to the target tissues where they bring their action and cure influenza virus. Now next question may be asked, what could be the mechanism by which latex of this plant is curing influenza? One of the most proven scientifically is the interplay of cytokines. It is seen here that whenever there is infection, there is release of more bad chemicals we call pro-inflammatory cytokines in red, and those outweigh good chemicals called anti-inflammatory cytokines in green. When we give antiviral drugs, pro-inflammatory cytokines decrease and anti-inflammatory cytokines increase and bring their effects. It may be compared with a seesaw. The good cytokines, that is anti-inflammatory cytokines, appear more and more, especially interferons. Those specifically kill the viruses. A vital question may arise in the mind that the plant works on influenza virus, then how I am correlating with coronavirus? What is the hypothesis? It is based on the symptoms. There is great research interest in influenza-like illnesses ILI. CDC website shows much similarities in both. Influenza and COVID-19 both are caused by viruses. Number 2, both are highly contagious viruses. Number 3, both spread from person to person contact. Number 4, both attack immune compromised people. Number 5, both are asymptomatic excretors. And number 6, both are RNA viruses. It shows that pink eye is caused by viruses too and is highly contagious. One more new study that also supports hypothesis is from American Academy of Ophthalmology. It says pink eye is symptom in many COVID cases as per the latest research in April 2021. Study mentions that eyes are vulnerable to COVID-19. Some people may ask me, are we proposing a cure for coronavirus? This is what we need to understand. I am not proposing a cure at this time, rather I am sharing my ethnobotanical and traditional knowledge and experience to use the plant as a self-care preventive measure. This is very important to understand. I am proposing that if people use it, then this plant may help stop spread of coronavirus. It may work in asymptomatic people to help inhibit growth of coronavirus. It may help reduce risk to life due to the virus. As I shared it, that when you apply it on perionychium of toenail, it may work like a subcutaneous vaccination. The modern vaccination theory also says, and several doctors have said the same thing, that those who got full dose of vaccine, they have low risk of life due to coronavirus. This plant might work similar to other antiviral drugs on coronavirus too. Then another question may be asked that what are the risks involved in the use of this plant? I would say very low, as neither this plant is eaten nor injected intramuscularly or intravenously and simply applied on the skin, risk is almost nil. Yes, as the plant latex is toxic, so care should be taken that it should not go to mouth and eyes directly. As per United States of Department of Agriculture USDA, it is considered as GRAS, means generally regarded as safe. So here is my family using the latex of this plant as a self-care and preventive measure to protect ourselves from the coronavirus. This is the website of United States of Department of Agriculture. It shows pharmacology and ethnobotany of this plant. There are several phytochemicals present in different plant parts. The latex also shows many phytochemicals like these. Here it mentions that plant usage is as GRAS. Also, as per Ayurvedic information, this plant has already been used in respiratory diseases. Let us listen to the Ayurvedic doctor, Dr. Sonali Bihana.
अर्क को आयुर्वेद की बहुत ही महत्वपूर्ण औषध माना गया है। अर्क का अर्थ ही है सूर्य के समान उष्ण एवं तीक्ष्ण। आचार्य चरक ने भी अर्क को षट्शोधन वृक्ष में से एक माना है। शोधन का अर्थ ही है शरीर की सफाई करने वाला। अर्क की सामान्यतः दो जाति मानी गई है, श्वेत जाति एवं रक्त जाति। रक्त जाति को हम अर्क कहते हैं तथा श्वेत जाति को हम राजार्क या मंदार कहते हैं। औषध में इसके विभिन्न अंगों का प्रयोग किया जाता है, जैसे क्षीर, पुष्प, फल, मूलत्वक आदि। क्षीर इसमें सबसे महत्वपूर्ण माना गया है। क्षीर को हम लेटेक्स या दूध भी कह सकते हैं। इसमें ट्रिप्सिन नामक जो कि प्रोटीन पाचक का काम करता है तथा हृदय पर अन्य कार्य करने वाले जैसे स्कैरिन, कैलोट्रोपिन, कैलोट्रॉक्सिन आदि तत्व भी पाए जाते हैं। इसके कटु, तिक्त एवं उष्ण होने की वजह से यह कफ निस्तारक का काम करता है, यानी कफ को निकालने वाला, तथा श्वास का काम करता है, यानी रेस्पिरेटरी डिसऑर्डर्स में इसका मुख्य कारण।
Now let us have the glimpse of an ancient literature of this plant. It works on respiratory system, controls temperature, and used parts are root, bark, and the latex. And it is especially anti-inflammatory. Here the cheer means latex applications have been well defined by the ancient Ayurvedic scholars. Please note these slokas mentioned in the Bhav Prakash, Rajnighantu, Charak Sukti, and so on. Hope by now you may be convinced by its potentials and you may ask who can use it and how many times and how to use it. Anyone can use it. A person of any age, maybe barring very young kids, it may be used on both toenail perionychium. Healthy person to prevent himself or herself from getting infected. Any asymptomatic person to prevent the spread of infection. Symptomatic persons, all health workers, doctors, nurses, technicians, helpers, volunteers may try this as a self-care preventive measure because they are in direct contact with the active cases COVID-19. In my experience, once I was losing taste little bit and there were no any other symptoms of coronavirus and been quite healthy. But when applied it once, my taste returned after 2 days. That amazing effect I have experienced myself. My wife and young son are regular user of it as seen in the video, along with the usage of mask sanitizers and social distancing. Ethnobotanically, it is applied once in a day and for 5 days when person is infected with influenza. As a preventive measure against coronavirus, it may be applied on both toenails just once by healthy person and maybe for a few days as preventive self-care. It would be better if applied at night to give enough time to get it absorbed in the body, though it adjusts very fast through the skin of nails. Now you may be thinking, if people wish to use it, then where they can find this plant? It is very much around you. It is offered to Lord Shiva in temples. You can talk to temple people. It is available in nurseries also. You can buy from them. It is present in medicinal gardens, on roadsides, on wasteland, in parks, in open field and farmers field and many other places. Please take care that latex oozes out for a short period of time and after snipping the leaf from stem and then slowly flow stops. So it is better to use it immediately and fresh. If you talk about distribution of this plant in the world, it is found in many parts of the world and natives of those countries may also use this nature's treasures for free. We are doing further research on it. Basic research has been started since March 2020 last year and we are looking for support for advanced research. You may leave your queries if any. Thanks for watching. Stay safe, stay healthy.